An integral part of President Barack Obama's healthcare reform vision involves improving quality and reducing costs, two efforts that may often appear to conflict. A new University of Michigan study, however, demonstrates that you can improve quality and reduce costs by taking a collaborative approach to healthcare.
Here at the University of Michigan, I'm the Chief Medical Officer, and I am responsible for the overall quality of care that patients receive. And I was struck by President Obama's mission, which was to improve quality and reduce cost across the board. Typically, hospitals do that in the way that they think is best, but that has met with limited success. And so our idea was to try to get a number of hospitals together so that we could share and distribute information about best practices throughout a community of hospitals.
16 Michigan hospitals, together with the support of Blue Cross Blue Shield of Michigan, created the Michigan Surgical Quality Collaborative. By pooling patient data and sharing ideas, these hospitals were able to identify quality improvement strategies and reduce costs.
The percentage of patients who got a complication after surgery dropped by about 10% in the group that was in the Michigan Surgical Quality Collaborative. And in what we call the control group, the group that was outside of Michigan, it actually didn't drop at all during that same time interval. Surgical complications are very expensive. Once something bad happens following surgery, it takes a lot of resources for the patient to recover. And so if you can avoid a complication, then you saved all that money that you would have had to spend. And so that's what makes it economical to have a collaborative like this. If this system was adopted nationally, not just in Michigan, I think you would find greatly accelerated pace of surgical quality improvement as opposed to if the collaborations don't occur. So this is a system and an approach that the nation could take to improve surgical quality. I hope that we're able to interest the government in adopting this approach, or at least incentivizing this approach in many different regions throughout the country.